Today I'm speaking with Lou Beccaria, who is the president of the Phoenixville Community Health Foundation, as well as Lynn Hartman, who is the vice president for community programs. We've been here a few months ago, so it's just so great to come back and to find out what's new and exciting with the foundation. Can you just state the mission for our audience again?
Oh, sure. And thanks for coming back. We really appreciate your being here. The mission of our Phoenixville Community Health Foundation is to help improve the overall health and quality of life of the people of the greater Phoenixville area, and to do whatever it takes in order to create a healthy community in whatever ways we can do that.
Okay, and are there any new and exciting new initiatives that are going on right now?
Well, as a matter of fact, there are. We have something called the Executive Leadership Institute, which we've just completed the second year of this 10-month program. And the Executive Leadership Institute is really a training program for existing executive directors of nonprofit organizations and aspiring executive directors. For those in those agencies that serve the greater Phoenixville area, the 19 townships and boroughs that we serve as a foundation. And how this fits into our mission is that we believe that in order to have a healthy community, there needs to be a healthy nonprofit sector. And so we do a number of things, and this is the newest thing, in trying to ensure that the nonprofit community benefit organizations are as healthy as possible by having executive directors who are trained in leadership skills.
That sounds great. So who is eligible to enter into the program?
Current executive directors and those that may be assistant directors or program directors, those that are aspiring to be executive directors.
Is there a specific selection criteria?
There is, and I'm going to let Lynn actually cover that.
Okay.
Well, the selection criteria, actually, it's more first come, first serve, first qualify.
Okay.
So we're actually, as Lou had said, looking for executive directors, program directors, or any staff within the nonprofit community here in the greater Phoenixville area who've been identified by their executive director or their board as really key future leadership for their organization. So it's really, of those people who are qualified, it's first come, first serve for the program. We only take 12. There's only 12 individuals in each class. And just to talk a little bit about the uniqueness of this, because, you know, there are a lot of leadership programs. It seems to be a real key buzzword right now, leadership development. And there are a lot of leadership programs out there. But I think what makes ours particularly unique is that we take the approach of a personal leadership journey. This is a 9-month program.
Oh, wow.
You know, it's scheduled from September through June. And during that 9 months, we have a series of faculty members who come in and address a certain aspect of leadership. But at the very beginning of the program, we start out with each student taking the Myers-Briggs test. And then the first session of the class is we have Dr. David Wyman come in and really talk about what all that means on a personal level. And our evaluation of the program really encompasses the personal journey. So after every class, the students need to list 3 personal takeaways that they have identified that they need to work on. So at the very end of the class, their final exam actually is to present to their classmates and to us basically their personal leadership strategic plan with goals, action steps, and timelines. These are the things I need to work on for my leadership skills, and this is how I'm going to do it. And they're different for every person. Every person comes to the table at a different place.
Right.
So I think that's what really makes it very successful. And it has been successful. Our first evaluation of last year's program is done, and very, very clearly showed that there is a long-term impact on the behavior of each individual student who's been through the program. So So
That's
it's really
great.
quite exciting for us.
That's great. And as Vice President for Community Programs, are there any new programs that are currently going on right now within the foundation?
This is our newest baby right here at the Executive Leadership Institute. But we do have a scholarship program that we've been facilitating this scholarship program since 1999. It is a community partnership. This scholarship program is designed for graduating high school seniors who plan to study in some health-related career choice or curriculum. It's an $8,000 scholarship payable over 4 years, so it's a substantial scholarship. We have partners in the community partners who help us with this, the Phoenixville Hospital, the Phoenixville Hospital medical staff, Phoenixville Hospital thrift shop ladies, believe it or not, and all come forward every year to fund a scholarship. And we draw from all of the school districts within our service area. So it's Phoenixville, Springford, Pottsgrove, Methacton, Perkiomen Valley, and Great Valley school districts, along with any private schools that may be operating in the area. Like we have a charter school here. We also have a parochial high school up at John Paul.
Okay.
So we draw applicants from all of those schools.
And what is the selection criteria for that?
Well, they need to, academics, extracurricular activities, community service. Financial need is the last determining factor on the scholarship. And they also need to write an essay to us telling us why they've chosen a career, why they want to pursue a career in healthcare. So the students, the finalist students come here for a personal interview with members of our scholarship selection committee. And this year we had 16 students who interviewed, and we had 5 scholarships to award. So it's competitive. It's very competitive.
Oh, wow, that's wonderful. As a foundation, can you speak to the audience about, more specifically, who you serve and what services you provide?
Sure. Well, we serve a 19 township and borough area that basically is the service area of the Phoenixville Hospital. It spans parts of Chester and Montgomery County. And the reason it's designed like that is because as a health conversion foundation, we came about 16 years ago through the merger of the Phoenixville Hospital with the University of Pennsylvania Health System. And the university and the Phoenixville Hospital's service area is those 19 townships and boroughs. So we're kind of giving money back and doing things to serve that same community. We have taken, as I said before, community health as a concept that we've really embraced. And we do a whole lot more, as is evidenced by the programs we've been talking about, than just give out grants, which is about $2.5 million a year in grants. But we firmly believe that a foundation has lots of other roles to play, and we try to play those roles as an initiator of programs, as an ambassador for the community, as a broker to bring organizations together around certain issues, or a catalyst and a capacity builder. The Executive Leadership Institute could probably fall under the topic of the capacity building. We're trying to build the capacity of the nonprofit community benefit organizations, their capacity for leadership. Okay, so we're very busy, and we do lots of different things to maximize the resources that we're privileged to have at our disposal for the benefit of the community.
Well, I want to thank you both for taking time to speak with us again.
Thank you for
Happy to
having
be
us.
back here. Thank you.
All right. Thank you very much.
Thank you.